This is 8.1 ePortfolio assignment, PPA 521A, Instructor Werner. I'm Ryan Henderson. This video contains revised versions of government's role in societal program provision, week 2, proposed societal problem, week 5, and stakeholder engagement map, week 7 of PPA 521. I live in Saanich, a municipality on Vancouver Island, and the HSAC is a voluntary advisory committee that contributes in various ways to help promote a healthy lifestyle for its citizens. Each meeting begins with a traditional territorial acknowledgement and the diversity, equity, and inclusion statement. The traditional territory acknowledgement goes as this. It is appropriate that we begin by acknowledging that the District of Saanich lies within the territories of the Lekwungen peoples, represented by the Songhees and Esquimalt nations, and the Wasanich peoples, represented by the Sartlip, Paquachin, Sault, Sinkum, and Malahat nations. The diversity, equity, and inclusion statement goes as this. We are committed to celebrating the rich diversity of people in our community. We are guided by the principle that embracing diversity enriches the lives of all people. We all share the responsibility for creating an equitable and inclusive community and for addressing discrimination in all forms. The committee's purpose is to promote effective communication, engagement, and collaboration between the municipality and its citizens, and advise council and recommend policies to support a healthier and more livable community. The mandate of the HSAC consists of developing and recommending policies to council, responding to council's request for advice and information, providing advice to council on projects, policies, or bylaws, review and provide feedback on the strategic plan, and basically to provide a community perspective on promoting personal safety, security, and the high level of physical and social environment, and inclusion, and sound growth management for community sustainability. It fosters public awareness and facilitates the growth of the community. The advisory committee is a diverse membership with respect to gender, age, and cultural ethnic background. The committee consists of 11 members qualified in the discipline relevant to the committee mandate or with a perspective necessary for fulsome consideration of the associated topic. This includes 1 member of council to serve as chair, 1 member from Saanich Community Association Network, and 9 community representatives appointed by the council, including 1 youth member. Councillor Ned Taylor is the chair. He's the youngest Saanich councillor, and he's the CRD director. That's the Capital Region director. And he's born and raised in Saanich, and he graduated from high school in 2017. He's passionate about the environment and climate change, affordable housing, transportation, and building a better community that works for everyone. He has several appointments. He's a chair of parks and theaters, Regional Water Supply Commissioner, and he's a liaison for agriculture. As mentioned, the group of 9 are very diverse. One example is Teal Banderoff. He's a PhD in political and international studies from the University of Cambridge. He's a dedicated environmentalist and has formed several environmental groups. There are also several MAs with social development type backgrounds and a lawyer. So I just wanted to refresh people's memories about the nature of advisory committees. They can fluctuate in power about what is accepted or rejected by a municipal council. They can also be used as a kind of scapegoat for municipal politicians. Municipal politicians can use these committees to escape blame or prop up their own views. This particular committee has had some significant things accepted, such as the diversity, equity, inclusion statement that I read before. So they're a little bit higher on the ladder of participation that's displayed here. There's a citizens advisory board section here, but I think it has a little more influence than that. In this case, it has been decided by council to send the matter of recovery from the COVID pandemic to the committee as a sort of a think tank. And I like to say that it could also be a tool for reassuring the council and their administrators that they are moving in the right direction for recovery from the pandemic. So here is a part of the beginning of the process for the group to consider options. We want to amend the strategic plan and have a goal to support mental health and well-being of the residents as a result of the pandemic. Projects, ideas are going to be approved and developed by the committee, and a report will be made, and then a report will be finalized. So here is a prompt for HSAC to consider for thinking about when it comes to Saanich citizens re-emerging from the pandemic. Within the upcoming meetings, ideas will be brought, discussed, and debated as to what would be viable for healthy options to suggest to be put in the report and then submitted to council. I'd like to start off with the Oxford Political Science Dictionary's definition of stakeholder. One who has a stake in a business or a policy. In its modern usage, the word is deliberately contrasted with shareholder. A shareholder has a particular kind of stake, namely a share in capital. A stakeholder's stake may be labor or land or a consumer interest in the business or policy. Political writers who talk of a stakeholder society therefore mean one in which interests over and above shareholders are effectively represented. The less defined the interest, the harder it is to see how the stake is to be claimed or protected. The second definition here is from the community toolbox provided by the course. Stakeholders are those who may be affected by or have an effect on an effort. They may also include people who have a strong interest in the effort for academic, philosophical, or political reasons, even though they and their family, friends, and associates are not directly affected by it. So the toolbox divides these stakeholders into three groups: of primary, so who's directly affected by a policy; the secondary stakeholders who may affect a policy; and a key stakeholder who is, for example, a public administrator who has the power to move resources. Stakeholders' interests can be many and varied: economics, social change, work, time, environment, physical health, safety and security, and mental health. So my project is with the latter, is physical health and mental health. So the community toolbox gives the directives to define the issue, define the outcomes intended to achieve, identify the nature of the population, explore the context. So my focus is going to be on community wellness and on prevention of deterioration. I think this will focus around social connectedness and a sense of efficacy. And this will require health and development efforts involving collaborative partners as catalysts for change. This will result in a multi-pronged, multifaceted interventions, ideal or an ideal, and in general necessarily create real and permanent social change. So the outcomes will be intended to create risk reduction and protective factors for the community. So what I thought I would do is take some examples from my sustainability concentration on capacity building and demonstrate where I think stakeholders would have a great impact. So this figure is borrowed from Honadel, is in the references. Um, the stakeholders would most likely be in the areas, concentrated in the areas circled here. So recruitment of personnel is a stakeholder area. At the first stage of anticipating change, we're trying to think who's going to be affected and how the stakeholders will react to possible policy. So when stakeholders are engaged in the abstract resources, they go through the process of absorbing the resources and managing the resources. And then to the second circled stage here, to how's it going to be evaluated to change the policy again, to adapt to what stakeholders think the needs will require. This figure is borrowed from Chaskin. This is a relational framework, and I think the stakeholders will be in the middle area here. So they'll have a sense of community, a sense of commitment, an ability to solve problems and access resources. They can be individuals, organizations, networks, and the functions they will do are planning and decision making, governance, producing services, and information dissemination. This is another figure borrowed from Chaskin. The figure describes a neighborhood and family initiative in Milwaukee. It's building of community capacity. I believe the stakeholders are in section 2 that's circled. Formal organizations, community building organizations, and individuals that participate in the planning and governance of the services. They'll contribute to the outcomes, and then those outcomes will adapt to new strategies. Canada has universal health care, which means many things. Canada's healthcare system isn't really free, as there's monthly premiums or yearly premiums to pay, as well as taxes which pay for the entire healthcare system. In Canada, there's access to universal health care regardless of status, income, employment, health, or age. The administration of healthcare is done on a province-to-province basis. So when we try to evaluate the efficiency of the universal healthcare in Canada, it's hard to pin down how efficient it is, but we know all our shareholders, and as a group, we are stakeholders in everybody being as healthy as possible. Healthcare is an investment. It is an easy access to equal services for everyone, which will be a good future outgrowth to the increase of productivity and to cut back on the number of illnesses. For this reason, the coverage is universal and unrestricted. Where to get medical treatment is free as long as it doesn't cover things such as prescription drugs, dental care, as well as eye care or glasses. However, drugs are set up to be cheap by pharmacy companies at a federal level. So a pro to this system is educational programs that reduce costs. There are programs that work towards preventing injuries and teaching citizens about health issues. There's more public awareness about health risks, and these programs are funded by the government. These programs are created to help reduce health care costs and teach people how to take control of their health before there are serious problems. There are programs for seniors, those with disabilities, awareness campaigns for back injuries, and so on. These programs help people in Canada stay healthier because they get more education about health-related issues. Another pro is the excellency in primary care. In general, the system is focused more into improving their medical resources for chronic illnesses and other technologies. Some medical treatments such as cardiovascular disease and many forms of cancer diseases are handled much better than other countries since these chronic illnesses are the number one causes of the death rates. Thus, in certain Canadian provinces, a team of healthcare experts are given out more promotional events to the community on health and illness prevention. So in general, the effect of COVID-19 quarantines has changed the dynamic of health in Canada for the time being. So a quarantine is defined as a restriction of the movement of people, animals, and goods, which is intended to prevent the spread of disease or pests. It is often used in connection to disease and illness, preventing the movement of those who may have been exposed to communicable disease, yet do not have confirmed medical diagnoses. It is distinct from medical isolation, in which those confirmed to be infected with a communicable disease are isolated from the healthy population. Quarantine considerations are often one aspect of border control. In British Columbia, province's top physician Bonnie Henry, for the past year has announced and implemented health orders that restrict citizens' movements and associations in an attempt to curb the spread of the COVID-19 virus. For many, this has resulted in a sedentary lifestyle. Isolation and restricted activities can have deleterious effects on one's personal health, as it may relate to a sedentary lifestyle. Sedentary lifestyle changes a person's physiology, as argued by Owen et al. And Tremblay et al. These effects can cause further harm if people are not properly reintroduced into activity. And if people are reintroduced to rigorous activities in large groups, this may have a larger effect and impact on the healthcare system because of cardiovascular events or simple injuries. This requires a strategy for a return to thriving, and consulting health professionals before people rush out to be active again is a prudent course of action. Once the quarantine orders are lifted and people may resume to their lives, people should be aware of the risks of potential harm. In order to do this, public administrators may want to consult professionals like physicians about how to go about in the process and recovery. There may be other factors involved, such as the long haulers, which Ruben 220 has noted that we really don't know the effects the pandemic and people who caught COVID-19 will be in need of, what services they'll require. And some warnings, for example, on a municipal website may recommend citizens consulting a physician before they start to engage in vigorous activities. Other healthcare or health-oriented professionals should be consulted. For example, nurses, physiotherapists, even personal trainers or gyms, in order to understand what kind of capacity that needs to happen in order to make the policy or program happen most efficiently, and so we don't overload our healthcare system with people with cardiac events or just injuries like torn muscles or injuries along those lines. So once professionals are consulted, a media campaign can be created cautioning the return to a newer normal. So that can happen on radio, television, or websites. And once the initial response occurs and the reflection on how things may happen, an adjustment may occur again, and we can make those adjustments from there. Some references.